Okay. Okay. Hello everyone. My name is Christine Gabriel D. Suetas, and today I will be demonstrating the application of cold compress to a patient. So the first thing that we need to do is to identify our patient using the 3 identifiers, which is ma'am. May I please know your full name po?
Francesca,
And your birth date?
December 1, 2000.
And may I please check for your wristband for validation? Okay. So now that we have identified our patient, we need to identify and verify the doctor's order, including checking for the moisture of the cold compress, check for the duration, location, and the desired temperature needed as well. And then we need to check for the client's medical history and if there is any contraindications that might prohibit the use of the warm or hot therapy. Okay, the next thing that we need to do is to assess for the client's skin and also check for any wounds, for its size as well, color and drainage. So we can see that there's a small swelling right here on her arm, so we need to apply cold compress to reduce the pain. So the next thing that we need to do is to assess for the client's family as well, for the background of the family's awareness regarding this procedure and other safety precautions. Next is to check for the patient's vital signs as well. Just check and monitor, including the BP, RR, and etc. The next thing that we need to do is to identify any expected outcomes, which will be explained to our patient. And the final expected outcome is to reduce the patient's pain and provide comfort. Next thing that we need to do is to assemble all our equipment, which is right here. Some gloves, alcohol for hand hygiene, our basin for the cold compress, some drape and towel. So we will need to organize this so that we can proceed to the procedure accordingly and in an organized manner. So the next thing that we need to prepare is to explain the procedure to the patient and with also the client's approval, and also tell the patients for the possible sensations that she would feel. Ma'am, I will be applying a cold compress to you, so you might feel a cold, and it will relieve your pain and your swelling as well, and will provide you some comfort. Would you like me to proceed, ma'am, to help you ease your pain? Okay, so after describing everything, we can now provide for the patient's privacy at all times by closing the doors and curtains. So close the curtains and the door while doing this procedure. So we need to position the patient po in a comfortable manner. Let me position you, ma'am. Are you comfortable? And make sure to have a proper alignment and expose the part that is only needed to be exposed, such as the arm where the swelling is on. So in this case, in this arm, so we need to provide the patient's privacy and security at all times. Next thing that we have to do is to perform hand hygiene and wear PPE such as gloves before proceeding to applying the cold compress. So perform hand hygiene and let it dry, and make sure all that the equipments are ready before submerging it to the water. So now I will wear my gloves. Now that we're done with gloving, we will now put waterproof pad under the patient's arm where the cold compress will be applied. So okay, and then we need to submerge the water. And of course, after submerging the gauze pad or the washcloth to the basin, bring out excess moisture. Okay, and please now tell the patient that you will be putting the cold compress to the area. Mama will be putting the cold compress po. So you might feel coldness on that area. Okay, then apply and make sure it is molded over the site. And make sure that it will settle as well. Excuse me. Next is to remove and remoisten moisten, and then reapply it to the patient. I will be putting again. Sorry if it too much cold on you. Yeah. Okay. So after doing so, you can now check for the patient's skin for its conditions. Okay, do you feel any reliefness, ma'am? Somehow? Okay, are you okay? Next is to stop. We can now stop the application if the patient feels uneasiness or any discomfort. So we can ask the patient, ma'am, do you have any do you feel any pain po? Like such as, do we need to stop this procedure? Do you feel uneasy or anything? So just please tell me. Do you feel too numb? Nothing at all. So does it ease your pain naman po, ma'am? Okay. Now we can stop the application if the patient feels unusual. So, but we can remain it as well if the patient says so. So we need to put it right here. So is it okay for you to be relieved? So now we can remove our gloves and perform hand hygiene. Okay. Now we can assist our patient to be in a comfortable position or manner. Okay, make sure that the arms are draped. And then you can now also inspect for the area or the wound. Okay. Okay, I see that it is also relieved and it doesn't look like too much swelled at this time. And I will now ask you, ma'am, ask the client to describe the level of pain. Do you feel any pain po? Would you like to rate your pain po from 1 to 10? 3. So as we can see that the patient's pain scale is down at 3. So she doesn't feel any pain much as before we apply the cold compress. And then we can inspect and identify any unexpected outcomes. And then we can now document the finding and report as necessary. And then we're done for the cold compress.